Diolch, Llywydd. Y bore yma, mae yna awgrym y galla'r JCVI argymell newid y grwpiau blaenoriaeth ar gyfer brechu. Os ydy tystiolaeth sy'n dechrau ymddangos rwan yn dangos bod brechu'n cael effaith ar sut mae'r feirws yn cael ei drosglwyddo hefyd. Hynny ydy bod o'n nid yn unig yn stopio rhywun mynd yn sâl, ond yn gwarchod pobl eraill o'i cwmpas nhw hefyd. Dwi'n gwybod mai dilyn cyngor y JCVI ydy polisi Llywodraeth Cymru, ond all Gweinidog dweud wrthon ni pa mor barod ydy'r Llywodraeth i newid y strategaeth os oes angen, o ran yr is-adeiledd digidol, angen rheidiol ag ati. Ydy'r Llywodraeth yn gallu gweithredu polisi newydd ar fyr rybudd os mai dyna di'r cyngor mae'r Llywodraeth yn ei gael?
Well, there's a bit of a hypothetical question there about what we can do if a certain change is or isn't made. What I think is much clearer, though, and I think it is a fair question to ask, is if the JCVI, the independent expert group who have given us advice on how to make the best use of vaccines, how to provide the greatest public health benefit, how to save the greatest number of lives, if their advice were to change, what would be the position of ministers? And I think that's a fair question. And I'm happy to say that if the JCVI do change their advice, I'll obviously consider it, the advice I get from my Chief Medical Officer, and I would expect that the position and the policy direction of the Welsh Government would then change as well. Because throughout this, I've been interested in making choices that follow the advice as clearly as possible and helping to save lives. The JCVI, I think there's a different way or a better way to do that as we understand more about the vaccines we have available, as we understand more about COVID and its various strains and types, then of course I'll be prepared to change my decision and what that means for the Welsh Government and our National Health Service-led vaccination programme.
Dydy hynny ddim yn ateb yn nghwestiwn. Ni'n nid gofyn a fyddach chi yn newid polisi nes i, ond ydy'r capacity ganddoch chi, ydy'r gallu ganddoch chi o fewn eich systema i ddilyn trywydd newydd os oes angen, a pha baratoadau sy'n cael ei wneud am hynny. Os ga i symud ymlaen, mae'n amlwg mae'r Brechlyn Rhydychen AstraZeneca sydd wedi bod yn cael ei ffafrio, achos i fod yn fwy hyblyg yn haws i'w ddefnyddio o ran storio a'i drosglwyddo ac yn y blaen. Ond wrth i dystiolaeth yn cyrraedd ni o Israel yn arbennig, dwi'n meddwl am sut mae'r feirws yn cael ei drosglwyddo gan bobl sydd wedi cael ei brechu. Mae'n edrych yn bosib, a nid rhywbeth rhethregol ydy hyn, achos mae angen paratoi ar gyfer pob amgylchiadau gwahanol. Bosib mai dim ond yr un Pfizer fydda yn dangos yr gwelliant yma o ran trosglwyddiant. Rwan, mae hwn yn fath newydd iawn o frechiad. Mae'r dechnoleg newydd yma, mRNA, yn debyg o fod yn rhan amlwg iawn wrth ddelio efo pandemics yn y dyfodol. Ni fydd angen is-adeiledd wedyn sy'n caniatáu rolio allan y brechlynau mRNA yn gyflym iawn ar angen i cadw nhw'n oer ag ati. Ydy'r Llywodraeth rwan yng nghanol y pandemig yma a'i llygad ar ddatblygu yr math yno is-adeiledd ar gyfer y dyfodol, yn ogystal â gweld pa mor gyflym mae posib rolio allan ar gyfer yr broblem da ni'n wynebu heddiw?
Well, of course, we'll consider the developing evidence base on the effectiveness and characteristics of vaccines and the threats that we're looking to combat. And I think going beyond that is rather unhelpful and speculative, because we need to understand the confirmed evidence rather than what may or may not be developing. There is always the potential for different things to happen at various points in time. I'm confident, though, that the flexibility and the can-do attitude that our NHS has shown throughout this crisis is something that will also help us with future events as well. And it's also worth pointing out, I think, that I do think we should look forward to a more optimistic end to 2021 than the year we've just gone through. But that doesn't mean that the year will be risk-free. Even as we vaccinate the adult population, I don't think people can look forward to going back to entirely the way things were at this point in January 2020. I think the challenge is that we're going to be living with COVID for some time. Once we have protections from a vaccine, we'll have the changes that you and I would see every year with the flu, for example, where different strains emerge. There's a need to consider how we best protect people. I think what we need to build in as a regular part of our infrastructure. And that would, of course, also feature in how we deal with new and emerging threats, whether from different strains of COVID or indeed other healthcare threats as well.
Diolch. I must say I'm disappointed that you seem to be brushing off my questions as being hypothetical ones. I want to see Welsh Government preparing for different eventualities, because if we've learned something in the last year, it's that this virus, this pandemic, can throw all sorts of curveballs at us, and we need to be preparing for different outcomes. Now, with case numbers thankfully falling as well, many people suffering after almost a year of severe restrictions on their lives will understandably want to know now the timescale for when they can get their lives back on track. Now, I'm not going to ask you today to give us that timescale, because, as I say, this pandemic has been a tale of surprise after surprise. So things can change even in a few weeks. But what I do want is an assurance that the Welsh Government does recognise the real hardships and health problems caused by the lockdowns themselves, that the central focus of government is to have an exit strategy from the cycle of lockdowns, and that there will be a recovery period that addresses the harms that have occurred, particularly, for example, to children and young people.
Well, of course, we recognise that lockdown comes with harms as well as benefits. And we've been very upfront about that in statements made by myself, by the First Minister, by the evidence papers we've published from our technical advisory group, and indeed the statements published by our Chief Medical Officer. So this isn't a new factor for us to take into account. It's always a balance between the harm that a lockdown can cause in terms of the greater sense of isolation, the dislocation between different people, the impact on children and young people. It's why we've been so keen to try to maintain face-to-face learning for as long as possible. It's why it's our first significant priority, as we've always said, in terms of being able to come out of level 4 lockdown measures as they currently stand today. So we recognise the longer-term impact of the lockdown measures we're taking, together with the significant benefits that lockdown is providing in helping to reduce infection rates, helping to prevent people acquiring COVID and the harm that would cause. We've already seen eye-watering and shocking statistics on the number of people who are in hospital now, the number of people who have lost their lives, the percentage of excess deaths matching and exceeding the excess deaths we've not seen since the Second World War. So these are extraordinary times we live through, and lockdown is an extraordinary set of measures. The recovery will both need to be economic, and people's loss of work produces health harms as well. We know there'll be physical harm to recover and to account for, not just in conditions like stroke and cancer, but also a significant challenge in terms of mental health and well-being as well. So we recognise that the health recovery will be long and significant, but I am confident that our NHS will stand up to that challenge. It will require our support, it will require our understanding, and it will require us to make choices about the budgets we have available to us. The next year, though, even though it will be difficult, the next term of this Senedd, even though it will be full of COVID-related challenges, is a much more optimistic one to look forward to, with that sense of recovery, as opposed to the last 10, 11 months we've just gone through. So I think all of us can have confidence that our NHS will still be here and fit for purpose as long as we make choices about how we support it as elected members here in the Senedd.